Hi, everyone. Welcome back. I'm here today with Dr. Kim Kelly today, who's a naturopath and just a wonderful doctor in San Diego. Welcome, Dr. Kim. Thank you so much for being
Well,
here
thank you for
for
having me.
the interview.
Well, thank you. And if you'd like, I'll just give a little background of myself. And I know this is part two, but I'll just kind of repeat a little bit what I've said in our previous podcast. But I'm Dr. Kim Kelly. I'm a naturopathic doctor, and I've been in practice since 2001. And I went to school in Seattle, Washington, at Bastyr University, which is one of the naturopathic schools, the accredited naturopathic schools here in the United States. And after completing that four-year program, then I did 3 years post-training with a team of medical doctors, acupuncturists, naturopathic doctor, chiropractor, and I did that for 3 years. And after completing that, then I moved to Encinitas in November 2004, and that's where I've been ever since. And then I got my practice going here in Encinitas in 2006. And then prior to that, I did work for a Carlsbad-based company on hormones. And so I was their consultant, helping other doctors, patients with hormone balance. And so now that's why in my practice, my main specialty is hormones, whether it be adrenal balance, hypothyroidism, sex hormone balance for both men and women, or women going through PMS and hormonal acne as well. And so through that company, then I got going in my private practice. And now I'm here in downtown Encinitas, and it's called the Encinitas Acupuncture and Massage, where I practice with a team of other great practitioners. So we have acupuncturists, massage therapists, we have a chiropractor, and we have an esthetician. And so I think there's 14 or 15 of us here in this office, and it's a great harmonious environment. And I know when patients come in, they always say, "Oh, it feels so peaceful here," and they also say, "It smells so nice here too." I can't smell it, but they can smell this nice fragrance in our office. But I've been here in this building since 2010, and I certainly hope to be here for a long time with these other great practitioners because it's been a wonderful environment. I consider my second family.
Lovely. Yes, it's definitely such a nice building, and everybody there has such a good energy. And I love that you guys have so many different specialties in the same building and that you
We do. We certainly do. And of this 14 or 15, six of them have owned it together. They bought this building in 1985. And so it's really nice where it's a co-op. And so they own it, they control the rent. So it's nice where it's not that corporate feeling renting space here in this building.
Yes, yes, definitely. A naturopathic doctor is very different from like traditional medicine, right? Because you guys are finding the root of the issue instead of just putting like a bad bandage on it, right? Like when people have different medical challenges. Hey, Dr. Kim, you were saying about the naturopathic medicine.
Right. So what differentiates the naturopathic doctors from the traditional medical doctors is we look more at the whole person. So when a patient comes in, let's say they have a headache, traditionally in an MD's office, they'll treat the headache. And of course, I have a lot of friends who are MDs, and for them, they really don't have the time because their office, they're booking them 10, 20, sometimes 30 patients a day. And so they just don't have that time. And in my practice, usually I see on average 3 to 5 patients a day, and that's it. And so this gives me plenty of time to see each patient where I can really address, okay, what's going on, what might be the underlying cause. And that's the big thing where I'll order a comprehensive blood test panel, whether it be their CBC, their lipids, hormones, micronutrients, inflammatory panel, full diabetic panel, full thyroid panel, full cardiovascular panel, or some of them are asking specifically for certain tests such as heavy metal testing, mycotoxin levels. And so we'll look at all of that to see is there anything that might be contributing, whether it be their headache, their brain fog, or they just feel very moody. And for other people, it's aches and pains, inflammation. And so that's why, if possible, I like to order that full comprehensive panel. And unfortunately, for some of these tests, actually, a lot of these tests is not covered by insurance. And so for many of these patients, it is out of pocket. And also in my practice, I don't take insurance either, but I do give patients a super bill, and I don't know what the success rate is for patients getting reimbursed, but some of them will ask for a super bill that they can submit to their insurance company. But anyway, as far as, that part, that's what differentiates us probably the most is the time that we spend. And then we try and get at the underlying cause and just look at the whole person. And I call naturopathic medicine the judo of medicine. It's more of the gentle way in trying to help someone. I mean, yeah, of course, sometimes even with supplements, patients, we have to take it carefully because some patients are very sensitive. And so even with supplements or even homeopathic. And so with homeopathy, that is more of an energy medicine where like cures like. And it's just the energy of that plant or substance to help the person, whether it be again with those same kind of symptoms, fatigue, brain fog, joint pain. And some of them respond really well to homeopathics. And other patients don't feel anything at all, and other patients for even that might be too much, just even the energy of the plant or substance and trying to get their body to heal. But we do know that our body, it does have an innate ability to heal. And so our role is what can we do to help their body to heal? The mind, body, and spirit. And of course, we all know the connection between the mind and the body. And something that I learned in school, and it's been repeated at conferences, is we know we are what we eat, we are what we think. And so there's that part too, just our mind. And of course, I'm not going to tell patients, oh, it's all in your mind. But we do know just how we approach our health or our disease has an impact too on how we may respond. Because I know some people, when they come in, they'll just automatically think, oh, nothing's going to work. So already they're kind of blocked. And this is where I'm hoping we can help them just to be open up, receptive, where we can hopefully then ensure that the healing, whether it be herbal medicine, homeopathy, bioidentical hormones, energy medicine, acupuncture, can help them to heal. And it's for most people, I tell them it's a marathon approach. It's not a sprint approach. And so for many of them, it's been several years where they've had these ailments. So that's why I usually tell them on average, I mean, there's no science behind this. For every year you've had this condition, let's consider 1 month to try and get that to heal. I mean, that's more in general. And so, of course, some people respond much quicker. Other people, it's slower. And I wish I could say I have 100% success rate. I don't. I'm going to say anywhere from 50 to 75%. But the big thing is I do my best. I try and do my best for everyone who comes in to see what can I do to help their body to heal, to help them be more receptive. But the biggest thing, my goal when patients come in, my biggest goal is I want them to feel that peace as well, no matter where they're at in their health, how they're responding with the treatment plan, where they can at least feel that peace when they come in and when I put them on the treatment plan. And
Yeah.
so that's probably the biggest difference for me, between a naturopathic doctor and a medical doctor. And what's nice though, there are a lot more medical doctors who are embracing our same philosophy as naturopathic doctors. So that's wonderful, where we call them integrative doctors. And and so I do work with a few of them. And so for patients who do have insurance or want to see a medical doctor who's integrative, then of course I'll refer them to an integrative medical doctor, or some of them still want to work with me. So then we'll collaborate with these holistic medical doctors. And luckily here in the San Diego area, we call it the healing arts. I mean, many of them are very holistic, the MDs, the DOs, and of course, there's a lot of naturopathic doctors here too, because we have our school here as well. So I went to Baxter University in Seattle, Washington, and now there's Baxter University here in San Diego, which is wonderful. So it's a 4-year program, and a lot of these students like to stay here. And who wouldn't? I mean, this is just a great place to be. So many of them are setting up their practice when they graduate. And so we have a really good population of naturopathic doctors for patients to choose from. And each one of us offers something different. I know there's other naturopaths who are also do hormones like me, but we all have a different approach where it's our own little style. And so for patients, if they want a doctor who's, more in a clinical environment or who has a big staff, then that's great. Then I'll refer them to that office. For me, my practice is just me. I answer my own phone calls. I do my own scheduling. I do everything on my own. And it's nice. So when patients call, I answer the phone. And of course, they're surprised. Oh, a doctor's answering the phone. But I like that. I've been doing that since I started my practice. And I know patients do appreciate that because then they can actually talk to the doctor, explain to me what's going on, and then I can determine, can I help them or do I need to refer them? And also they can decide as well, okay, well, am I a good fit for them too? So I think it's a good for both of us where we can see, okay, is this the right fit? And many of them do schedule with me, or of course, I'll refer them on to a colleague or to an integrated medical doctor if they have insurance. And so that's been my practice, and it's been that way since I started, and I like to keep it that way. And of course, I'm not like the super busy practice, but I just like the pace that I go at, and it's very comfortable. And I feel like I have a very balanced life with all the other things that I like to do besides practicing medicine.
Yes, yes, that's so wonderful that like, yeah, you answer the phone so people can immediately know like, okay, is this going to be the right fit for me? Sometimes when you call a regular doctor, you have to talk to three people before you even
Right,
doctor.
right.
So I love that you have such a personal touch and you care about your clients and you do exude that peace. I've had sessions with you and it feels very peaceful when you explain the blood results and I like how you analyze the blood results because sometimes, like traditional medicine will say, "Oh, that's within the normal range." But as naturopath, you're seeing that that's not really normal. Actually, it's actually could be in a danger level, like for thyroids. Could you talk to us a little bit about hormones? Because
Sure, sure.
hormonal glands and different things that
Yeah,
happen.
and back to what you were mentioning as far as ranges. So our range is usually much more narrow. When you look at the traditional lab range, it's like this, and we figure why wait till it's way on the outside or close to the outside. We like to keep the range narrow so that way we can do early intervention before it gets to more on the outside range of normal, whether it be too high or too low. And something else I wanted to add is, so when I see patients, I always like to tell them, keep in touch with me. I like to offer that concierge type medicine, and I'm not going to charge them that concierge type service. Or, any quick questions, just email me, call me, text me. I don't care. Just email me anytime. I may not be able to get back to them right away. And as long as, it's short, then of course I'll be happy to keep in touch with them. And for some patients where it gets to be really long text, emails, or voicemails, or a lot of emails and text, then I do say, let's just schedule a short consult and we can go over everything. But I like to offer all the patients that concierge type service too, so that way they can just keep in touch with me. So regarding hormones, so something that I referred to when I moved here in 2004, I worked with this wonderful company in Carlsbad, and there we did salivary hormone testing. We also did urinary neurotransmitter testing towards the end of my time there. I was there for 4.5 years, and so I got trained a little bit in that. But my main area there with the company was to be the main consultant or one of the consultants on hormone balance. And our big role was adrenals, the cortisol levels. And so we call the adrenal glands the shock absorbers of the body. It's what handles stress, inflammation, and that was our main role at this company to balance the adrenals because our theory is the adrenal glands, we call that the center of the wheel, and each spoke might be one for neurotransmitters, sex hormones, thyroid hormones, immune support. And so that's why we like to focus more on the adrenal glands, and that's the cortisol. So it's kind of like a car. When you have a new car, the shocks are very smooth, they work, and you don't feel the bumps as you go along. But as the car ages, or if the car is going super fast on bumpy roads, eventually those shocks will wear out and you feel every little bump. And same thing with the adrenal glands. Over time, with age, but also with a lot of stress, the cortisol levels usually go up and then they come down. And those little adrenal glands just eventually say, okay, I'm tired. I'm wiped out. I can't keep up anymore. And so then all of a sudden now every little stress, like boom, your body just feels it. And that's where we have that term, your body is tired, but yet it's wired at the same time. Because now it's like your car is running on fumes. It's running on low cortisol. Same thing with the car on a low tank of gas. It's running on fumes. It's not good for the engine. The shocks are worn out. So you feel it every little bump. And that's how some of these people, when they come in, because of the incredible chronic stress they've gone through or really short, intense stress, your adrenal glands need that help. And so that's one of the big things we as naturopaths and then me and my practice like to focus on. And so when the adrenal glands are wiped out, the cortisol is usually low, the DHEA is really low, which is the main hormone in the body, by the way. And DHEA, we call it an adrenal support hormone, and it's a sex hormone as well as support. But anyway, we support the adrenals, the cortisol, and then women who come in here, whether it be PMS, menopause, and then men who come in here with andropause, which is the female version of menopause, which is also usually in the 50s. That's where, okay, the testosterone in both men and women is on the lower side. Progesterone is on the lower side. Estrogen is on the lower side. So this is where I like to give them, whether it be bioidentical hormones. Some women, because of their health history, cannot be put on hormones. So this is where we use herbs. And then some women actually respond really well to homeopathic estrogen or homeopathic progesterone. So I'll put them on that to help balance the hormones and also the adrenal glands. And probably the youngest person I've ever seen where the menstrual cycle has completely stopped, where she was 25 years old and now she's seeing me in her 40s and she hasn't had a menstrual cycle. And that's where, okay, we've got to try and one, balance the adrenals and balance the sex hormones too, because we need the estrogen, or the women need the estrogen. Progesterone is more for their bone health, cardiovascular health, brain health, skin health, because it helps them look young. And so that's where if I would like to use bioidentical hormones to help get the menstrual cycle back. And I do want to say for that person, it's still work in progress. We're working with an endocrinologist because we just haven't been able yet to nail it, but she's had menstrual cycles here and there, but it's not the consistent regular cycle yet. But we're working on that. But in my opinion, I think we're getting close. And then for men, they go through the andropause, and that's the female version of the menopause. And usually the symptoms would be, oh, I'm just more tired. And same thing, they have this brain fog or maybe poor memory, just like with women. And then low libido and also poor erections. And this is where, again, it's adrenal support. And sometimes, we'll do testosterone, and whether it be bioidentical testosterone or herbs to support testosterone. And there's plenty of good herbs out there too, because again, some men cannot be put on testosterone because of their health history, or when I do their blood tests, some of the values are contraindicated to be put on testosterone. And so that's my main approach to help both men and women with the, whether it be adrenal support, sex hormone support. And then for women, many times as they go through perimenopause, menopause, the thyroid also starts to slow down too, because there's that direct relationship. And that's why many of them start gaining weight. And so this is where we'll have a little bit of thyroid support, but typically also just helping to balance the estrogen. Progesterone can also in some ways help their weight as well, trying to get the estrogen and progesterone up and both evenly, because we don't want them to be estrogen dominant either, where there's too much estrogen, because that will also create that bloating feeling, water retention, and possibly weight gain. And then the progesterone usually that we give the women going through perimenopause, it helps with their sleep, because sleep also starts to become less and less or more interrupted. And so usually the progesterone helps with their sleep when they go through the perimenopause.
Wow, so hormones affect so many things that people might not know. It's like affected by their hormones, right? Like
It is. And so when we look at estrogen, it has a big role for cardiovascular health. It helps with elasticity of the blood vessels. So that's why some of these women, when they go through menopause, they go, why is my blood pressure going up? Because the arteries become more stiff, and the estrogen helps with elasticity of the blood vessels. And we also know estrogen helps with cholesterol. And of course, it's the right amount. We don't want too much estrogen though either. But we know estrogen helps with reducing the LDL, total cholesterol, and in some ways it helps to raise HDL. And in men, we do know that just the proper amount of testosterone can also help with lipids. If you give them too much testosterone, that can do the reverse and lower their HDL and increase their cholesterol. But just the right amount, it helps to balance their cholesterol levels as well.
So you work with people of all ages, that they don't have to be above like 50. So you're saying that woman that was 25, she was even having
She
these
was in her 40s, yes,
changes?
coming in, and she wanted to get have help with her hormones. So I work with this great compounding pharmacy, close compounding pharmacy, and then I work with other local pharmacies too. But the main one is one in Oceanside. Actually, they just moved their closer to Vista now. But anyway, I work with them, and then we help the patients get their hormones balanced. And what's nice with this pharmacy, both Tammy and Dieter, they will spend time with all the patients when they do dispense the hormones, and the patients are also more than welcome to call them with any questions. And of course, the patients can call me too. So that's why I like working with this pharmacy because they're wonderful. They really spend time with all the patients.
I love that. I love that. And would you say like hormones also affect people's personality and mood? Because it seems like some people as they get older, like they become like this gentle grandma, grandfather energy. And then some people as they get older, they kind of get like more cranky, like get off my lawn, or like, why are these young kids doing that? So like this crankiness level of is that affected or
That's
by
that is the big one. And you know what's funny? I do get calls from the whether it be their husband, their partners, where they're calling me and say, "Hey, can you help my wife or can you help my partner?" Because she's changed. Her personality is different. And when they call, they know it's not my wife. It's not who she really is. And I tell them, well, it's hormones. Because of the drop in the estrogen, the progesterone, and also their testosterone, it does change their mood. And the other thing is they're probably not sleeping as well either. And so, of course, for anyone, when you're not sleeping, you just get more cranky. But even besides that, with the drop in the hormones during the perimenopause, yes, they become more moody or more weepy, or some guys say they're more bitchy because they can't help it. It's a lot of it is the hormones that's kind of influencing the way they are. And so this usually with a little bit of what we call bias, it's a form of estrogen and progesterone that helps to calm them down. And so usually it's actually the progesterone because it's calming. We call it the euphoric hormone. It helps us sleep because when it's broken down into something called allopregnanolone, which binds to the GABA receptors in the brain, and that's why we like them to take it before bed. And the capsule form is usually the best way, but cream form also does work where it's calming and it helps us sleep. But yes, it does help calm them down. It takes the edge off and they're not just so moody. And I had one gal, she was going through perimenopause where she's still having menses, but it was all over the place, where it'd be skipping months and other times it would be very heavy. She would tell me her husband was afraid of her just because she just didn't like who she was, just being that she would tell me. And so when we got her on the hormones, she was back to herself and happy about who she is now. And of course, I mean, now her and her husband, they don't have that
friction?
conflict, friction.
Yeah,
Mhm.
because a lot of these could be misdiagnosed as like psychiatric things, like they're giving them antidepressants or anti-anxiety, but what they need is hormonal
Good point. Good point, because they are recommended antidepressants. And they're
exactly.
going through their MDs, and I tell them, well, let's try this approach first. And I'm willing to bet this can help how you feel, your depression, your weepiness, or your moods. And it usually does. I can't say it always does it, but at 75% at least, it usually does help with their moods. And also they're sleeping better, which is a big one.
Yeah, sleeping better. Yeah, when I don't sleep right, I definitely am more cranky. That makes sense. Um, and then could you tell us about like the hormones and how they go with the chakra system of the body, right? I don't know if you can just run through them real quick, like which hormone goes to which chakra, if that's okay.
Well, as far as the hormones and the chakras, probably the biggest one is the root chakra. It's the what do you call that? The first level, the first, second level of the chakra. And I know that according to Carolyn Mace, it's the community, it's your family. And that's where we know when we can get the estrogen, progesterone, testosterone, it helps that root chakra. But then as you help the root chakra, the first and second, then if you can get up to what we call the third chakra, which is in the lumbar area, it seems like all of a sudden, then boom, that's when you just feel like, oh, I feel this enlightenment, or I just feel this little lift in consciousness, if you want to call it that. by helping. It's the base, it's the foundation, the first and second chakras.
Yes.
Where with the estrogen progesterone, some of them feel that with the perimenopause, crampy feeling, bloating feeling, uncomfortable feeling down in the pelvic area. And in men, they just feel that stagnation. Nothing's moving down there in the first and second chakra. So that's where a little bit of testosterone or pregnenolone or DHEA or ashwagandha, those remedies can help open up the root chakras, the first and second. And there we have flowing of energy. They don't feel that stagnation. And same thing with the women, things just open up. And then when you open that up, all of a sudden now you got the spring of fresh water going up. And this is where now it helps open up the other chakras. But it's more just feeling, oh, I can breathe. I feel free. I feel liberated. And then up here, they feel more of that peace because they're happy. One, they're more happy with who they are, how they feel, how they're treating others. But also in some ways, it is opening up here. In some ways, I can't say it's they're having a spiritual enlightenment, but they're just more at peace with who they are. And that's a good start.
With the pineal gland and the pituitary gland, right? Because the pituitary gland, is that like the master gland? Like it kind
Yeah,
of.
the pituitary pineal, but the pituitary gland, because that's where a lot of the hormones are made. But then something up here is what we call the crown chakra, the thousand petal lotus. And that's where when that opens up, well, this is what we call the Christ center, the third eye. You open that up, and then of course the whole spiritual world opens up.
Wow. The hormones and spirituality are definitely connected in your opinion, like that.
They are, and in my opinion, there is that connection. Just like we know there's a connection with the mind and the body,
Yeah.
there is a connection between the spirit and nature. It's the dance of the hormones, it's dance of the spirit and nature together. Because we know everything is interconnected, energy, matter, hormones, our cholesterol, red blood cells, they're all connected to each other. And so what I'm doing is just a small fraction, really, when you think about it, helping a person's health. Because yes, we do know the balance of hormones is very important, but then that then helps to balance the energetics of the person, because really we are all energy. And over time, whether it be, who knows, 20 years, 50 years, maybe we won't need hormones. Maybe it's just be the simple energetic shift and boom, everything's balanced. And it'd be great if it can happen in my lifetime, because I would love to see that happen, where it can be just that simple.
You were saying that some people respond to just a homeopathic remedy of.
Right, some people do because there are women and men who cannot be put on hormones because of cancer, cardiovascular history, or their gene SNPs that they have. And so therefore we just use herbs. And even with herbs, we have to be very careful. So this is where I like homeopathics. And luckily there are homeopathic estrogen drops, progesterone drops. I haven't used homeopathic testosterone drops. I don't even know if it exists, but I have used estrogen and progesterone homeopathic drops. And some women respond really well to that, where they feel like they are getting hormones through the energetics of these homeopathic progesterone and estrogen, which is really cool. I mean, some people, I know some of my colleagues say, oh, that's a placebo effect. Who knows? But we know it works.
The homeopathic is from Germany, right? And Germans are pretty serious people.
Oh, yeah,
They
they're
they
light
believe in
years.
homeopathy, like Germans are very serious scientists. And whenever I've tried homeopathics, I feel like it works. You just have to have the right remedy, right? So that's
Right,
like.
it's the right remedy and the right dosing, the right timing, the right potency. So there's so many components to that, but luckily with these different companies, they pretty much have it nailed as far as the potency, the amounts. And for the most part, for these people who do respond well, I'm glad that it works for them.
Yes, yes. Well, I love your approach. And I think like a lot of people that might be having challenges, it would be good for them to book a consult with you to go over all these things. So because if you're suffering for a long time and you've seen a lot of different doctors, like it's worth working with someone like you that's going to go deeply and look into all of these things. I encourage everybody to reach out to Dr. Kim. And then Dr. Kim, you were going to tell us about grounding, speaking of nature and the body.
Right. So this is where we can use Mother Earth. So when you look at the olden days, for example, they had leather moccasins, which connected well to the earth, or they just walked barefoot. When I was a kid on the farm, we were barefoot, barefoot all the time. And so we were always grounded to the earth. And then I did a lot of camping in the Boy Scouts, and there again, we slept on the ground, on the earth. And back then I could handle the hard ground. It didn't bother me a bit, but now I can't. I need a nice mattress. But anyway, I was grounded. And so nowadays, of course, we have, our shoes, it blocks
Mhm.
the us from connecting to the earth, or we're indoors all the time, we're on concrete. I'm in my office. And so my office, I do sit on this grounding mat. And we know the earth, they give off electrons. And it's these electrons from earth that helps the body to heal. And of course, it's the right amount. And so, for example, in these outlets, there's that grounding hole, it's that little round hole. If you put a probe in that grounding, in that plug, in that hole, that's what connects to the earth. But before people do that, they have to make sure their outlet is wired right. And so there's this device that I don't have one here, but there's this device that you test to make sure it's grounded right, because if it's not, and you plug this grounding wire to that, it can actually create AFib, or heart palpitations, which you don't want. So you need to test your outlet first before you do plug in the grounding mat. And I did test the outlet, and it's fine. It was safe. And then I sit on the grounding mat, so I can at least get 30 minutes, maybe 1 hour, when I'm sitting on my chair with the grounding mat on my chair. And at home, what we decided to do, and we just did it the last weekend, we have a grounding bed mattress. And we took the wire and plugged it into the ground. And so we purchased this grounding rod that you push. It's 12 inches, no, 14 inches long, and it pushes all the way into the ground. I pounded it in, and then we connect that wire to our bed mattress, the grounding bed mattress. And so now we're grounded through just directly from earth, which is, I think, even better. And I know we recommend that for people who are really sensitive, just because if they do plug into the outlet in the grounding hole, it can actually be a little too much. It can stir things up. Yes, it does help with inflammation. It helps with pain. It helps with cardiovascular health. It helps with circulation. But for some people who are really sensitive, when they plug it into their outlet, it's way too much, and they feel agitated, or they actually may have worse pain. So this is where we do recommend, if you can, get the grounding rod and push it into the ground, and then take that wire through the window and plug it into your bed or to your mat on your chair. And there's much more subtle. It's much safer too for those people who are really sensitive. So we just did that, and I wanted to measure the difference between the drop in voltage. And so we have this voltage meter that I used, and I tested it when it was grounded into the outlet,
Mhm.
and it dropped too close to zero. And then I thought, because we want it to be at zero. And then I then took the grounding rod, plugged it into the ground, connected that, and then tested the voltage meter. It dropped to zero. So it's the same response, but yet it's more gentle for people who are sensitive. And that's what we do recommend for those who are sensitive, if they can plug it into the ground.
And do you guys feel a difference like in
I
sleep?
feel a difference. I know for me, it's better sleep.
Mhm.
And then for my wife, she's using it more for the inflammation, because she has an autoimmune condition. So she's using it more for that to help tone down the inflammation.
Oh, wonderful, wonderful. Yeah, well, I look forward to hearing like the results in like a month or two. But that's great because we spend 8 hours, at night on the bed. So it's like,
We're on the grounding bed mattress now.
yes, I love.
Mhm. And then our dog sleeps with us. So now our dog is grounded too.
Yeah, I bet Sadie feels happier, right?
Oh,
Like,
she's very happy. And plus, for her, it's just good enough being between us.
yes, of course, she's your guys' baby. So that
Mhm.
makes sense. That makes
Absolutely.
yes. And then you wanted to talk to us about the 4x4 breathing method, I believe.
Yeah, it's something that I like to teach patients if they're open to it. And it's just a way to calm down the body and the mind, because we know if we can calm down the mind, we can calm down the body. And also, it slows the breath down too. And so, if we can slow the breath down, it calms down the mind. And so, it's something that you can find online, but I like to do it in the office if they're open to it. And it's 4x4 breathing, where you inhale through the nose for 4 seconds. You hold for 4 seconds, and then you breathe out for 4 seconds, and then you repeat that 4 times. And then after the fourth time, then you just sit in silence. And I tell people anywhere from 1 to 2 minutes. That's it. It's just a little reset. And then during that 1 to 2 minutes, then I tell them just be aware of the breath, where you can put your hand on your stomach and just be aware of the breath. And then as you breathe in, you can say, breathe in peace. As you breathe out, you can say, breathe out love and spread the love. Or whatever word comes to their mind. And so if you'd like, we can just do a little practice here.
Yeah.
Do 4 by 4. We'll just do for 1 minute.
Okay.
Okay. So let's breathe in through the nose for 4 seconds. Hold for 4 seconds. Breathe out for 4 seconds. Breathe in 4 seconds. Hold. Breathe out. Breathe in. Hold. Breathe out. One more time. Breathe in. Hold. Breathe out. And then we'll just sit in silence for about a minute. Be aware of the breath. And some people like putting their hand on their stomach. So as you breathe in, you can say the word, just mentally say peace. When you breathe out, you can say, breathe out love. We'll do this for a minute. Slowly open our eyes. And it's a nice little reset. You just feel calmer. I
Yes.
do.
Yes, for sure. And I like the count. It's easy to remember, right? 444. And
Mm-hmm.
and I know you're a long-term meditator, so I think that people that are spiritual would definitely be inclined to work with you because then you understand the spiritual side, the body side, and the emotional side.
Right. And doing this also helps each of us to stay in the moment
Mhm.
as well, because that's another key thing. Just be in the moment. And
Yes.
that's another reason why I like this. It
Yes.
just brings you back to earth.
Yes, exactly. I love that. With everybody's busy schedule, it's like a good way to stop in the middle of the day and do this.
Yeah, you can do it anytime on the bus, probably not when at a stoplight, but or at home before bed or when you wake up. It's a nice little reset.
Wonderful. And just last question, Dr. Kim, is there any foods that you would recommend for people to eat regarding their hormonal balance? For example, like are there certain foods that people could be eating that might be good for them for their
Well,
hormones?
probably just in general, I like just good whole foods. Think whole foods, and also, if possible, organic.
Mm-hmm.
especially dairy products and meat, organic. Because we know with meat and dairy products, there's probably hormones in there, pesticides, antibiotics, and now you're putting that in your body. And then by all means, I tell people do not heat foods in plastics because we're hearing more about microplastics. And unfortunately, these microplastics are what we call xenoestrogens. They mimic the hormones, but it's not the natural hormones. And so for some people, when they're taking foods from plastic, heating foods in the microwave in plastic, they're getting that in their body and they're endocrine disruptors. They can disrupt your thyroid, your estrogen, progesterone, maybe even testosterone. So I tell them do not heat foods in plastic, but whole foods, organic. And then for people who do have thyroid issues, we know soy foods can also be thyroid disruptors too. And so we tell them just be mindful of how much soy products you're eating. And we also know a lot of soy products are GMO anyway. But anyway, just watch the amount of soy foods too.
Fantastic. Wow. Thank you so much. And is there anything else you would like to say as we wrap up our conversation today, Dr.
Well,
Kim?
if anyone has any questions, by all means, call me. I'll be more than happy to answer any questions or email me, and we can probably put that contact information below.
Of course, of course. Thank you again for your time, and I hope you have a wonderful day at
Thank
the office
you.
and really appreciate all the information you've shared with the viewers. I'm sure it's
Well,
gonna,
my pleasure.
yeah,
Okay.
thank you.
Be well.